Heart failure is sometimes known as congestive heart failure, and this occurs when the heart muscle doesn't pump blood as well as it should. When this happens, blood often backs up and fluid can build up in the lungs, causing shortness of breath. Some of the signs of worsening heart failure are shortness of breath, feeling dizzy or lightheaded, weight gain of 3 or more pounds in one day, weight gain of 5 pounds in 1 week, unusual swelling in the legs, the feet, the hands or the abdomen, a persistent cough or chest congestion, increased fatigue or a sudden decrease in your ability to do normal activities, a loss of appetite or nausea, a feeling of fullness or bloating in your stomach, and confusion or restlessness. A new University of Colorado at Boulder study involved lab rats, and it indicates that low-intensity exercise may significantly delay the onset of congestive heart failure. This appears to have some promising implications for humans. According to the Professor Russell Moore of the CU Boulder's Integrative Physiology Department, who led the study, the lab rats carrying the genetic characteristics for the spontaneous developing of the heart failure were shown to live significantly longer if they exercised moderately on a treadmill. The exercise protocol, the equivalent of daily leisurely strolls in humans, extended the life expectancy of the rats in the study group by at least 10 to 15%, according to the study. Assuming the results are applicable to humans, low-intensity exercise is likely to have benefits in the early stages of congestive heart failure. Recent studies suggest that CoQ10 might be beneficial for people with cardiovascular conditions. A team of researchers from Duke University's School of Medicine in North Carolina found that CoQ10 supplementation can improve the symptoms of congestive heart failure. This chronic condition affects the pumping power of the heart muscles. In the people with congestive heart failure, the heart is unable to keep up with the body's needs, thus increasing the risk of premature death. Remarkably, the researchers found that several studies on CoQ10 and heart health reported improved markers of congestive heart failure in people who took 60 to 300 milligrams of CoQ10 supplements daily. In particular, CoQ10 supplementation fortified the heart and the blood vessels, thus enhancing the blood circulation. The researchers also found evidence that the CoQ10 supplementation increased the amount of ATP in the heart. High levels of ATP are crucial for people with congestive heart failure, since ATP helps to boost the pumping power of the heart muscles. The ATP is generated in the mitochondria. For more information on other ways to improve the mitochondrial function and to increase ATP levels, see my other video on mitochondria to learn about the supplements like PQQ, D-ribose, creatine, and techniques such as exercise and cold water exposure, and the research chemical SR9009. D-ribose can aid the recovery of ATP levels, and hence diastolic function. Clinical trials have shown that ribose supplementation improves ischemic threshold, and it enhances the diastolic function in congestive heart failure. Cardiac and skeletal muscle creatine levels are depressed in patients with congestive heart failure. Oral supplementation of creatine could increase the physical performance in these patients. Although cold water exposure can help to increase mitochondrial function, cold shock would not be advised for people who are suffering from heart disease. Exposure to the cold causes a vasoconstriction and a tachycardia, both resulting in a rise in blood pressure and cardiac work. This last effect may have deleterious influence on people who are suffering from ischemic heart disease. The drug SR9009 works by capitalizing on the circadian clock inside the heart, the genes that turn on and off at specific times to regulate the heart rate, blood pressure, and other functions. In mouse models, administering SR9009 shortly after a heart attack reduced inflammation and scarring, allowing the heart to better repair itself. The researchers reported the results in Nature Communications Biology. SR9009 works by disrupting genes that would normally activate immune responses after a heart attack. In mice, it tampered down the production of NLRP3 inflammasome, which is a protein complex that promotes scarring. When they combined the drug with conventional therapies used to promote the blood flow after heart attacks, the animals' hearts healed to the point where it almost looked as if no cardiac event had happened at all. Widely used as a lipid-lowering agent, omega-3 fatty acids have been demonstrated to possess the potential to reduce the risk of cardiovascular events in patients who are suffering from chronic heart conditions. Typical doses range from 3 to 9 grams per day of an EPA-DHA omega-3 fish oil blend. Omega-3 helps to raise good cholesterol and lower bad cholesterol. Hypercholesterolemia is a risk factor for the development of coronary arterial disease. However, several reports have suggested that low serum cholesterol is associated with a worse prognosis in patients with congestive heart failure. You can check out my video on cholesterol and weight loss for more information on natural ways to help to balance your cholesterol. Gaining even a little weight can increase your chances of developing heart failure, a new study has found. Adding pounds can change the structure of your heart and its ability to pump the blood. You can check out my video on weight loss for more information on how to help to lower your weight safely and effectively. In patients with congestive heart failure, the presence of adequate total body magnesium stores serves as an important prognostic indicator because of an amelioration of arrhythmias, digitalis toxicity, and hemodynamic abnormalities. Both potassium and magnesium deficiencies are common and can be associated with risk factors and complications of heart failure. The best form of magnesium to supplement with would be magnesium bisglycinate. To determine your dose, slowly increase until side effects like diarrhea or stomach discomfort are noticed. Then gradually reduce the dose until you can determine your maximum tolerable daily amount that does not cause any side effects. As magnesium is required by over 300 enzymatic processes in the body, it can have profound benefits after a few months of supplementation. Another supplement that complements magnesium is zinc, as it's also required by around 100 processes in the body, so taken together they can have many synergistic benefits improving your health. In cross-sectional studies, patients with heart failure often have zinc deficiencies, suggesting that the effects on the ongoing pathogenesis of heart failure are related. Low plasma and myocardial zinc levels may cause reversible cardiomyopathy in patients who have nutritional deficiencies. Be sure to take an absorbable form of zinc, as many forms have poor bioavailability. Vitamin C as an antioxidant may help people with heart failure by calming down the inflammation in the body. The best form of vitamin C would be liposomal vitamin C. You can check out my video on how to make this easily and cheaply at home. The next best form would be a non-acidic buffered form of vitamin C, with the worst form being cheap acidic ascorbic acid. Inflammation plays a central role in the development of heart failure, especially in heart failure with preserved ejection fraction. Furthermore, the inflammatory response enables the induction of the regenerative processes following acute myocardial injury. You can check out my other videos on inflammation, antioxidants, and autoimmune conditions to learn about natural ways to help to reduce inflammation in the body. Quercetin protects against atherosclerosis, oxidative stress, cardiotoxicity, endothelial cell dysfunction, and heart failure, etc. Quercetin has potential as a lead molecule in drug development programs for cardiovascular disease. Quercetin is found naturally in certain fruits, such as the peel of grapefruit or in elderberry juice. It's been shown to increase the absorption of zinc, vitamin C, and the antiviral nutrient shikimic acid. About 85% of the general population carries a variant of the MTHFR gene, and it's associated with higher blood homocysteine, which is a risk factor for cardiovascular disease. Green vegetables, folic acid fortified foods, and vitamin B supplements can help to reduce the risk. You can check out my video on the MTHFR polymorphism for more information about this. Increasing vitamin D intake could prove to be beneficial for those with congestive heart failure in several ways. A 2016 study published in the Journal of the American College of Cardiology found that vitamin D supplements taken by people with chronic heart failure were associated with improved cardiac function. As most people are deficient in vitamin D, you should get a 25-hydroxy vitamin D blood test and then supplement accordingly with vitamin D3 to correct any deficiency. Thiamine plays a crucial role for normal cardiac function, since severe thiamine deficiency leads to congestive heart failure. Alcohol abuse or diabetes and prediabetes may also lead to a thiamine deficiency. Glutathione is the body's master antioxidant. Numerous circumstances can cause a reduced glutathione level, such as mercury amalgam dental fillings, heavy metal toxicity, or cysteine and selenium deficiencies. Glutathione is essential for cell survival, and a deficiency in cardiac and systemic glutathione relates to heart failure progression and cardiac remodeling in animal models. You can increase your glutathione by supplementing with reduced glutathione, liposomal glutathione, N-acetylcysteine, selenium, such as your 200 micrograms per day or 3 Brazil nuts, and by eating the herb asparagus. One study shows a severe deficiency of the essential trace element selenium can cause myocardial dysfunction, although the mechanism at the cellular level is unknown. Moderate selenium deficiency is associated with worse symptoms and outcomes in patients with heart failure. From the previous slide, it's likely that this selenium deficiency causes a glutathione deficiency, and that could be one of the main contributing factors here. Stimulated endothelium-derived, relaxing, factor-mediated vasodilation and conduit arterial dispensability are impaired in congestive heart failure. L-arginine could have a potentially beneficial role in the congestive heart failure, acting through the nitric oxide L-arginine pathway or by growth hormone increment. L-citrulline also gets converted to L-arginine in the body, so it would have similar benefits. It's suggested to take 5 grams of L-arginine and 5 grams of L-citrulline on an empty stomach each morning and night. From the apple family and sometimes eaten as a food, for example, as a jam or a juice, the hawthorn berry is beneficial for people with heart failure, as it's been shown to improve the heart function and to decrease symptoms like shortness of breath and fatigue. It's also considered by some to be an adaptogen, meaning that it can balance any imbalance that's in the body. The berries are traditionally taken for physical heart problems, whereas the leaves and the flowers are taken for emotional-related heart problems. Many reports have shown that garlic has lipid-lowering, plasma, anticoagulant, and antioxidant activity, and it improves endothelial injuries. The extract of garlic was effective to reduce blood pressure, arterial stiffness, inflammation, and other cardiovascular disease. There's debate on the benefits of vitamin E on heart failure. Mainly supplementation with synthetic vitamin E appears to increase the risk, whereas a mixed tocopherol natural form of vitamin E may help to reduce the risk. Dr. Christopher would add cayenne and lobelia to all of his formulas, as he viewed them both as adaptogens and enhancers of other supplements. Cayenne is used for conditions of the heart and the blood vessels, including to improve the poor blood circulation, to reverse excessive blood clotting, to lower high cholesterol, and to prevent heart disease. In hypothyroidism, symptoms may include a slowing of the heart rate, constriction of the blood vessels, and increased blood pressure, retention of fluid and edema, and an increase in cholesterol levels. Severe cases of hypothyroidism can cause heart failure and even death. You can check out my videos on high and low thyroid function to learn about natural ways to help to control your thyroid. For example, nascent iodine, tyrosine, and selenium can greatly help with hypothyroidism. And the occurrence of iodine deficiency in cardiovascular disease is frequent. Iodine supplementation might prevent the worsening effect of iodine deficiency on the cardiovascular disease. Clinical studies have shown that probiotic administration can potentially be helpful in the prevention of cardiac failure and an improvement in the quality of life. The only probiotic that I would recommend is the strain VSL3, as it has the highest colony count and the most scientific studies to back up its efficacy. You can also improve your microbiome by consuming raw milk, kefir, yogurt, kimchi, kombucha, and sauerkraut. Fiber is also beneficial for probiotics. Soluble fiber found in beans, oats, flax seeds, and oat bran can help to lower total blood cholesterol levels by lowering the low-density lipoprotein, or the bad cholesterol. Studies also have shown that high-fiber foods may have other heart health benefits, such as reducing the blood pressure and inflammation. Some research shows that resveratrol could be linked to lower rates of inflammation and blood clotting, which can lower your risk of heart disease. Typical doses range from 500 to 1000 milligrams per day in the form of trans resveratrol. Curcumin, the active compound in turmeric, may repair exercise intolerance faced by patients with heart failure. This is suggested by new research. The people with heart failure have a reduced function of the left ventricle of the chamber of the heart that pumps the blood out to the rest of the body, called a reduced ejection fraction. Typical doses range from 1 to 5 grams of curcumin per day. In order to enhance its poor bioavailability, it should be consumed with biopterin, which is a black pepper extract, or an oil such as coconut oil, fish oil, butter, or ghee. For more information about the herbs or supplements mentioned in this presentation, or any other health condition, check out my website.